Hey everybody, it's Matt Shu from Upright Health, and in today's video we're going to be talking about hip labral tears or acetabular labral tears and whether or not surgery to remove chunks of them makes any sense. Now, for a very, very long time now, there has been this idea that labral tears are a cause of pain, a cause of hip dysfunction, when in fact a lot of recent research actually shows that people have labral tears and they lead to absolutely no symptoms. You have a very, very high number of people who are completely asymptomatic, no hip problems, no movement problems, who have labral tears, which is evidence that labral tears themselves do not actually cause movement issues. The example I like to give people is, if we have a theory that says black hair causes headaches in people who have black hair, then how do we have people who have black hair and no headaches, right? If we said this, if I went out and told you, hey, black hair causes headaches, people who have black hair have headaches, and I don't have headaches, that should make you think, well, maybe the black hair doesn't cause headaches since you have all these people with the black hair and no headaches, right? So same exact thing is going on here. We say labral tears cause all these problems, but then we see all these people with labral tears who have no problems. Should really make us want to rethink the theory. Now, this study is called Modest Midterm Outcomes After Isolated Arthroscopic Debridement of Acetabular Labral Tears. This was published in April of 2014 in the journal Knee Surgery, Sports Traumatology, and Arthroscopy. So they look at a whole bunch of different kinds of surgeries. And in this paper, they are basically looking at the surgery to remove only bits of labrum, of hip labrum, acetabular labrums. All the patients that were operated on between 1998 and 2005. So this was actually before FAI or hip impingement and bony hip impingement became a really popular diagnosis. This was during a period where they weren't really commonly shaving bones to fix your hip. Okay, so the idea at that time was, okay, you have a labral tear, that little flap is causing your hip problems, so let's remove that flap. Don't worry, once you remove that flap, you'll be all good to go. So in 2014, they went back to look at the actual results of these surgeries. Now remember, these surgeries were all done with the promise of, hey, if we do this, you're gonna feel much better with your hip problems. So what they found when they looked back at 57 patients was overall, 45% of the hips failed and required either repeat surgery or rated abnormal or severely abnormal. So 20% of the people they operated on for labral debridement ended up needing surgery again because they had some hip problem, and then another 25% still had abnormal or severely abnormal hip function. Okay, so basically, you have a 50% chance that things are going to go wrong if all you do is remove the labrum, right, or bits of the labrum. So what they mentioned in a little more detail is that 7 people ended up having to get, or 7 hips had to do total hip arthroplasty. They had 2 open revisions and then 3 arthroscopic revisions. And so what they came to conclude in this paper was that removing bits of torn labrum is not really a good idea, right? When you look at this, you have a 50% failure rate. Why would we do this? Now, what's interesting is in this paper, they say, well, the reason we think that these surgeries failed, the reason we think people ended up with problems, again, is because we didn't treat the bone when we went in. So what they suggest is instead of cutting the labrum, you should cut the bone. Leave the labrum intact, cut the bone, and that's going to solve the problem. So the analogy I would give for this is if you had squeaky bicycle brakes, like you squeeze on the handles and your brakes go beep. The analogy here, it would be, let's say I'm your bike repair guy. I say, okay, you have squeaky brakes. I know what the problem is. It's because the brake pads are, there's a little defect on your brake pad. So all we need to do is actually remove that little bit of brake pad, and that should solve your problem. That squeaky part, there's just something wrong with it. We're just going to take a little bit of that off, and then you won't have that contact with that abnormal part, so no problem. And then I check in with you, and 2 years later, you still have these squeaky brakes. So I say, well, actually, what it is, it's not actually the brake pad. It's actually the rim. So we probably just need to do a little bit on the rim. If we can just shave that down, maybe make that part a little smoother so that it doesn't squeak so much, then maybe we'll be okay. And after 6 months, your brakes are still squeaking, and at that time, I say, well, maybe we should just replace the whole rim. Right? So this is basically what's going on. Is we're looking at different bits and pieces and blaming those bits and pieces for what really is a global problem. Right? The way these things interact is extremely important. But to say that the solution to fixing a movement problem is to simply cut out something doesn't really make sense when you recognize just how many muscles are involved around the hip joint. So in this case, you had a theory which was, hey, let's just remove the little flappy piece which we think is causing a problem, which now we know doesn't actually cause a problem. And now that we've established that that doesn't work, let's just remove something else. If we can remove that other thing, maybe that will solve the problem. Of course, when you look at actual statistics about how satisfied people are after these hip surgeries, it should give you a lot of pause. If you haven't already seen one of the articles I've written about the history of FAI and all these hip surgery things, I would definitely suggest you check it out. I will provide a link in the description section of the video here on YouTube. So, according to this paper, debridement for hip labral tears, not a good idea. You should instead cut the bone because that will maybe solve the problem. However, if you look at other studies that look at actual satisfaction rates with FAI surgery, arthroscopic surgery, to shave down bone and then correct the bone problem, you will find that that actually itself is also not so great an idea. So I just wanted to show you this article, talk about it. I will link this as well in the description section so you can reference it yourself. It's a really clear example of how these theories are morphing and how dangerous they can be when you are one of the first to be undergoing these kinds of procedures, right? Those people, those half of the people who ended up needing more surgery and still had problems are clearly not people who are going to be particularly happy with the way that turned out. And it's because the whole whole surgery was based on a largely untested idea, which now has been shown to be really shaky. So I hope this gives you some much needed perspective if you're considering having somebody cut into your body to either cut pieces out or shave pieces down. And I hope you remember that pain sucks. Life shouldn't. If you like this video, please remember to subscribe and check out some of our other videos about your hips and your health in general.